Doctors, what's the biggest case of faking it you've ever seen? 1. Taking trauma call during surgery residency. Had a prisoner come in after a fight and claimed he couldn't move or feel his legs. All the CT scans and MRIs were normal, but we would shield his legs so he couldn't see them and poke them with needles and other sharp objects with enough force to cause pain. He never flinched or moved his legs at all. He was diagnosed with spinal cord injury without radiographic abnormality. He stayed in the hospital for a week, no improvement. Always had one guard with him. One night they were down in the lobby watching some television, but the guard needed to use the restroom. The patient said, "Where could I possibly go? I'm paralyzed." Guard left him alone for 2 minutes. The patient was last seen sprinting down the road, naked butt cheeks flapping in the breeze. Made it to a city 4 hours away by car before he was caught again. I have never seen anyone fake it so well. Truly playing the long con. 2. Had a patient come in for a fall who now couldn't move their legs at all. Did a bunch of tests, didn't find anything. The patient was not at all fazed by suddenly being paralyzed, which was the first red flag. Didn't really believe anything was wrong, but the patient was still not moving their legs. My options are to admit them for a huge workup or get them to walk. So I update them saying everything is fine, tests are negative, and you can go home. The patient gets up, gets dressed and walks out without a word. 3. We had a patient faking a seizure, so my supervisor told one of us to get the brain needle. The patient made a miraculous and swift recovery without intervention. 4. Physical therapist here. A working mom comes into the clinic with her infant in a stroller. She's limping like she's got a nail in her foot, wincing in pain and tears in her eyes. She was crying during her visit with the PT. None of us think she's faking it. She limped out of the clinic. I glanced out of the window and saw this woman bounding down the sidewalk, hips swaying, full stride, going places. We were all fools. 5. My brother was an EMT for 2 years, and he told me this. People will try to use the ambulance as a means of transportation from Fulton to Oswego, by faking seizures. Sometimes when the head EMT guy was feeling fun and knew that the person was faking, he'd say something like, "Man, it's weird that he's having seizures but not peeing himself." Apparently the person would kind of snap out of it for a second, weigh up the repercussions, then either pee themselves or stop faking. I thought that was hilarious. 6. Had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated hello wave. She started to throw her arm up too but caught herself halfway through, then threw her hand back into her lap and pretended to be staring off into nothing. 7. Nurse for an ophthalmologist here. Had a 21-year-old new patient claiming to be completely blind from a sudden and severe glaucoma diagnosis from a previous unknown doctor. Would feel around while walking and tried to keep their eyes rolled back into his head. The whole 9 yards. He said he is a famous YouTube rapper who is now unable to make videos or earn a living. I exclaimed that I had heard of him before and very excitedly asked him to search and show me his YouTube channel on my phone so that I could subscribe. He took my phone out of my hand and effortlessly found the YouTube app and typed away in the search bar. Oh. And of course, his eyes were back to normal and focused. 8. I'm a nurse. We had a guy who had to come in every 3 months to get a medical certificate to say he couldn't work at his retail job due to severe disabling back pain. He was receiving large amounts of insurance money for this condition. After the doctor had done his usual examination and questions and signed it off, the guy asked the doctor to check his shoulder, which the doc did, and asked how he injured it. The guy says playing rugby for a competitive team. Really, says doc? How long have you been playing for them? The guy has been playing and training the whole time. Doc puts this info on the insurance form. Doc loses his poop in staff room laughing. Next week the patient loses his poop in reception because his insurance has been cancelled. 9. ER nurse. Bringing a patient back to a room who said he had kidney stones. I had him stop at the bathroom and get a urine sample. The dude comes out with a specimen cup that literally has a piece of concrete in it. Looked him in the eye, expecting some sort of joke. He was serious. I threw it away and walked his dumbass back to the waiting room to contemplate his stupidity. 10. My cousin got glasses. Her 7-year-old little sister also wanted glasses because she thought it was so cool to wear them. So she started telling her teachers she couldn't read what was on the chalkboard. She'd squint at home and go incredibly close to the TV to watch things because she said she couldn't see things clearly. Her parents got worried and took her to the doctor. She read everything wrong on the vision test. Everyone seemed convinced that she needed glasses, but the doctor was a little concerned because the tests indicated she needed thick glasses, and usually that wasn't the case unless there was a family history of vision issues. Her parents both had 20/20 vision, and her sister only had astigmatism. They all realized she was faking it. So the doctor told her parents in front of her that she'd need some pretty intense eye surgery so she'd be able to see without glasses. They even wheeled in a machine to make it convincing to say they could do the surgery right then and there. She freaked out, confessed to faking it all, and started to cry. She got grounded for a while. 11. Years ago, I had a patient who had been rear-ended in an auto accident a few weeks before I saw her. She had a history of lupus. She was decked out in the usual crippled paraphernalia, crutches, neck brace, elbow braces, wrist braces, knee braces, and could barely walk. I saw her a couple of times, and she showed no improvement. One Saturday, I was on call but had to take a back streets route to the hospital because of an event taking place on the main thoroughfare. I apparently drove through her neighborhood because, wonders behold, there she was wearing old lady spandex power walking down the sidewalk, holding weights in both hands. I did not call out to her. Next week, she was back in clinic, with her crippled get up on again. A few weeks later, I got the subpoena for the deposition, and it all became clear. 12. Not a doctor but nurse. I once read a specialist consultation report and at the end of the report the actual diagnosis given was fictitious ailment. 13. My mom was an emergency room nurse. Years ago, they brought a prisoner from the local pen in who seemed to be unconscious. The guards were suspicious that he was faking it. They checked his vitals, and everything seemed to be okay. The attending doctor tried poking him in the foot with something pointy. Nothing. Then he got an idea. They took a rubber hose and inserted it in the back of his throat as if they were intubating him. That did the trick. He sat up very quickly, coughing and gagging. 14. When I was a kid, I learned I could fake sick and get out of school. So 1 to 2 days a week, I would get a migraine and hold my head and complain, and I would get to go home. Eventually, my parents took me to a neurologist who said, maybe you just don't let him eat chocolate and sugar? I admitted to faking and was grounded for a long time. 15. Women came to the ED with such excruciating belly pain, paralyzed, oh god, it hurts when you press there, and must have oxycodone now. ED doc said if she can get out of the ED bed and do 20 jumping jacks, we can give her the oxy. She did 20 jumping jacks, then got kicked out of the ED. 16. My mom's an ER nurse, and she said once some crazy lady came in and complained that she had the whooping cough, and whenever she coughed, she followed it with a loud whoop. 17. I'm an ICU and ER nurse. We get a lot of malingering in the ER. One day, one of our frequent flyers came in and started faking a seizure in triage. Now, obviously, I know this lady, and she's fake seized a million times before. But this time, it's in the lobby in front of about 30 people who have no way of knowing that it's fake. She's rolling around on the floor, making a damn fool of herself, and folks look horrified. I walked up to her and said calmly, Karen, what are you doing? To which this genius responds, I'm seizing. I told her to stop seizing. So she did. 18. When I was a kid, I would plan my sick days way ahead of time. Had an old thermos that I would pour leftover milk, meat, whatever, leave it on the windowsill in my bedroom just letting it fester for a month. I set an alarm for the middle of the night, dumped the contents of the thermos on my rug, and ran in to tell my dad I was throwing up and so sick. However, this thermos monstrosity filled the entire condo up with horrible smells, and both my dad and I ended up puking into the tub at the same time every time we tried to clean up the rug. He had to take the day off work, too. Needless to say, I never pulled that again. 19. No doctor, but a funny story from work a couple of years ago. The guy calls in sick for around 8 days and says on the phone he is really sick. Comes back to work the next week, tanned as F. This dude hands a medical slip to the manager written in Spanish. On the slip, there is an official seal from some random Cuban clinic. A guy walks over to me with a grin on his face, saying yeah, I'm probably fired. He was fired. 20. Once had a patient having a seizure. The other ER nurse and I knew she was faking it. He said as much. She suddenly stopped seizing, miraculously, looked straight at him, and yelled, shut up, fat boy. He and I laughed so hard. At least she wasn't having a seizure smile.